Let's continue our discussion for lesson skeletal system. So let's go now and let's discuss now the vertebral column. Okay, let's proceed to the first slide. So the vertebral column or the spinal column or backbone is made of individual bones called vertebrae. Or meaning to say, when you say vertebral column, it is actually the central axis of the skeleton in all vertebrates. The mammalian vertebral column consists of 5 morphologically differentiated groups of vertebrae, such as cervical, thoracic, lumbar, sacral, and caudal. So that was the mammalian vertebral column. So that is actually the definition for vertebral column, and actually the main function of vertebral column is that the protection of the spinal cord. So it is also provide the stiffening for the body and the attachment for the pectoral and pelvic girdles and many muscles in humans. In addition, function to transmit body weight in walking and standing. So that is the major function for vertebral column. So let's proceed to another slide. The names of vertebrae indicate their location along the length of the spinal column. There are 7 cervical vertebrae, 12 thoracic, 5 lumbar, 5 sacral fused into 1 sacrum, and 4 to 5 small coccygeal vertebrae fused into 1 Cossacks. Okay, so I'll eventually discuss it furthermore in the next slide. So always remember how many types of each vertebrae. So from cervical, thoracic, to lumbar, to sacral, and of course to coccygeal vertebrae. Okay, let's proceed. So this is the representation of the vertebral column. So this is the location of the 7 cervical, the 12 thoracic, and the 5 lumbar. So as you can see, nakikita naman sa illustration kung saan natin makikita ang types of vertebral column. Okay, so let's proceed. Another picture, another representation that can give us the location of the vertebral column. So this is for the human vertebral column. We have 7, 12, 5, and 5, 4, and 3. Okay, so that is each vertebral column, for each type of vertebral column. Okay, so let's proceed on defining what is cervical vertebrae. So cervical vertebrae, it is 7 cervical vertebrae are those within the neck. The first vertebra is called as the atlas, which articulates with the occipital bone to support the skull and forms a pivot joint with odontoid process of the axis. The second is cervical vertebra. To explain it more, when we say atlas and the axis vertebrae are the two most superior bones in the vertebral column, particularly in cervical vertebrae. They are part of the 7 cervical vertebrae, as I've said. The atlas is the topmost bone, sitting just below the skull. While when we say axis, it followed by the axis. Together, they support the skull, facilitate neck movement, and protect the spinal cord. So that is the the definition of the axis, or the explanation of the atlas and the axis. Always remember that atlas is the topmost bone and axis is the topmost bone, atlas, followed by the axis. So meaning to say, together with the atlas and axis, they support the skull that facilitate neck movement and protect the spinal cord. So how can we tell the differences between atlas and axis? So the key differences between atlas and axis vertebrae is that atlas vertebra is the topmost vertebra which holds the skull, while axis vertebra is the second topmost vertebra which provides an axis to rotate the skull, and atlas vertebra when the head moves side to side. So that is the differences between atlas and axis. Always remember that atlas is the topmost and axis is the second topmost vertebra. Which another differences of them is that axis provides the second topmost, which is axis, provides an axis itself to rotate the skull and to rotate the skull and atlas vertebra when the head moves side to side. That is why we can move side to side because of the atlas and the axis. This pivot joint allows us to turn our heads. Ito na, the statement. From side to side. The remaining 5 cervical vertebrae do not have individual names. So that's it. That is cervical vertebrae. If you have question, you can leave that in our GC. Next. So as you can see here, this is the location of atlas and axis. From the location of it, we can eventually know that the atlas is the topmost and the axis is the second topmost. So from the location again, we can eventually know that our head, that we can move or we can turn our head side to side because of these two feature of the cervical vertebrae, which is atlas and axis. Okay? Let's proceed to another type of vertebral column, which is thoracic vertebrae. If cervical is particularly on the what they call this on the occipital bone, or in the what they call this the neck part of our head, first bone of our neck, para ma-head or ma-turn natin yung ulo natin side to side, there is a cervical vertebrae. While thoracic vertebrae articulate forms join with the ribs on the posterior side of trunk. The lumbar vertebrae is the largest and the strongest bones of the spine are found in the small of the back. Or in other words, in this type of structure, in the thoracic vertebra, this structure have very little motion because they are firmly attached to the ribs and the sternum or your breastbone. So that is the major function of thoracic vertebrae. So aside from that pala, when we say thoracic, it is hold the rib cage and protect the heart and the lungs. Yun na nga sinabi ko, inulit ko lang pala, that when we say thoracic vertebrae, these are the structure that have very little motion. Why? Because they are firmly attached to the rib and the sternum. Why? Because they hold the rib cage to protect our heart and lungs. So that is thoracic vertebrae. Next, so this is actually the example of it. The lumbar vertebrae or the thoracic vertebrae. Next, we have sacrum or Cossacks. The sacrum permits the articulation of the two hip bones, the sacroiliac joints, and the Cossacks is the remnant of tail vertebrae, and some muscles of the perineum or pelvic floor are anchored to it. So as you can see in the illustration, we can eventually know the location of the cervical, thoracic, the lumbar, sacrum, and Cossacks. Is the sacrum and Cossacks are the same? Eventually in the explanation, the sacrum, sometimes called the sacral vertebra or sacral spine. It is a large and flat triangular shaped bone nested between the hip bones and positioned below the last lumbar vertebra. While the Cossacks is commonly known as the tailbone. It is below the sacrum. So meaning to say, there are a lot of differences between sacrum and Cossacks. From the location itself, makikita na rin natin that the both term is different. So sacrum is in the higher part, while below of the sacrum is the Cossacks, or it is called as the tailbone. Okay, let's proceed. So these are the location of sacroiliac joint and Cossacks. So another illustration. So this is the representation of each location. So don't worry furthermore. At least you know the location itself. Next. So since we've already done knowing that one, so let's go now on the abnormalities of the curves of the spine. So scoliosis. Scoliosis is an abnormal lateral. One of the abnormal curves of a spine is scoliosis. Scoliosis is an abnormal lateral curvature which may be congenital, the result of having one leg longer than the other, or the result of chronic poor posture during childhood while the vertebrae are still growing. Usually, the thoracic vertebrae are affected, which displaces the rib cage to one side. In severe case, the abdominal organs may be compressed and the expansion of the rib cage during inhalation may be impaired. Meaning to say, scoliosis can occur in people with conditions such as cerebral palsy and muscular dystrophy. So the causes of most of it is childhood scoliosis is unknown. Most cases of scoliosis are mild, but some curves worsen as children grow. So, of course, one of the question that in this part is, can scoliosis be cured? The prognosis for an individual with scoliosis ranges from mainly good to fair. Depending on how early the problem is diagnosed and treated, there is no cure for scoliosis, but the symptoms can be reduced. So meaning to say, there is no particular cure if you have scoliosis, but it's depend on what age or what time that you have a scoliosis. Kasi merong nangyayari na kapag bata pa, may possibility that the scoliosis can be threatened or can be reduced. But if it is old enough na, so meaning to say, mahihirapan siguro. So that is the abnormalities of curves, which is scoliosis. Okay, so this is an illustration. Example, picture of if the person are having a scoliosis. As you can see, the vertebrae or the thoracic vertebrae is not aligned. There is a curve, abnormalities of the curve. Okay, so types of scoliosis. So we have healthy, thoracic scoliosis, lumbar scoliosis, thoracolumbar scoliosis, and combined scoliosis. So these are the picture of each thoracic that has a scoliosis. Okay, so now let's proceed and discuss the kyphosis. So what do you mean by this term? So it is an exaggerated thoracic curve, sometimes referred to as an hunchback. Kyphosis can be occur at any age, but it is most common in older women. Age-related kyphosis is often due to weakness in the spinal bones that causes them to compress or crack. So that is the kyphosis. So as you can see in this picture, it represents the abnormalities of the curves if a person or if the individual has kyphosis. So what do you think is the best treatment for kyphosis? Of course, the treatment for postural kyphosis may include regular x-rays to monitor the curve, physical therapy, and in some case, a back brace can help the treatment or can treat the kyphosis. So that is the abnormalities of curves called kyphosis. Okay, let's proceed. So if there is a kyphosis, of course, there is lordosis. So it is exaggerated lumbar curve, sometimes referred to as sway back. If the kyphosis is hunchback, the lordosis is sway back. Lordosis is a small degree of lordosis is normal, but too much curving is called sway back. That is why it's called pala sway back, because of it. Nagiging normal na siya if it is small. Small degree of lordosis is normal, but if too much curving, that's why it's called now a sway back. The spine is divided into several sections, and the cervical vertebrae make up the neck. So that is lordosis. So that's why it said it is from lumbar curve. And how do you fix lordosis? There is a treatment, of course, a physical treatment with regards to lordosis. We have the sitting pelvic tilts on ball. What are those? We have we have so much physical treatments na pwedeng gawin para maibsan ang sakit na lordosis. You can sit on an exercise ball with your feet slightly wider, then hip width apart, shoulder back, and spine neutral. So, by that type of physical treatment, pwedeng maibsan or pwedeng ma-cure si lordosis. So, let's proceed. So, this is this is the picture if the person are having thoracic kyphosis and lumbar lordosis. So as you can see, ayan. So very kuba. Grabe pala ang kuba ng thoracic kyphosis, while lordosis naman is very chin out. Masyado. So that is because of the lumbar. Sa lumbar curve talaga siya nagkakaproblema. Okay? Yan. Another picture. So, that is the abnormalities of the curves. So, let's proceed now to another discussion of this part.